and we certainly need them. So thank you very much for being here. And I want to talk about what our biggest concern is. And obviously it's healthcare. We've seen a government that's obviously going in the wrong direction. This conservative government is pushing for further healthcare privatization, ignoring the crisis that's in our staffing and in our hospitals and cutting services. Bill 124, which was unconstitutional and is being appealed by this government, wasting millions of dollars on lawyers. Further staffing crisis in Ontario. Bill 60, which I sat in committee all weekend, is further trying to privatize our healthcare. It's hurting our community. It's going to hurt staffing in our hospitals. All of these decisions are, quite frankly, are going in the wrong direction. People need to have access to publicly funded, publicly delivered healthcare, and this government is making that harder. And we need it right here in Ontario. We need it right here in Niagara. After the disappointment of the budget when it came to healthcare, we saw the government announce, now think about this, we'll cut senior eye care. Currently, I'm a senior, by the way, so I can say that. I can get my eyes done every 12 months. They're going to now make it be 18 months. And we know how that's going to affect seniors. It makes absolutely no sense. They're always attacking our seniors. They announced the end of coverage for uninsured individuals in this province. A cruel decision affecting our most vulnerable in our province of Ontario. That's not how you build a system. It's not how you expand public health care. It's an attack on how to dismantle it. We have to stop the privatization of our healthcare. We need to have it publicly funded, publicly delivered. And that's what we need right here in Niagara. We deserve excellent public health care in this province in Niagara. And I want to say nothing less for all our communities in Niagara. And now I get the honor of turning it over to our leader, Marit Stiles. Thank you.
Thanks, Wayne. Thank you so much. Good morning, everybody, and thanks so much for joining us here today. We're actually in a wonderful public library. We love our libraries, and it's lovely to be here with MPP Wayne Gates and also with Lisa Gillies, an incredible community outreach worker. And we're going to be talking about how this government has denied people of the key element of universality of public health care for all, for the most vulnerable Ontarians, including here in Niagara. Very quietly last week, this government cut a small but very important program that provided urgent healthcare treatment to uninsured Ontarians. We're talking about undocumented workers, migrant workers, newcomers, refugees, international students, unhoused people, and those who have mental health or addiction challenges. In short, the most vulnerable Ontarians. This government quietly pulled the rug out from underneath them. The program costs an average of $5 million a year, as MPP Gates said, and it helped 400,000 people. That's less than $38 per person. If you put it another way, it's 0.01% of our healthcare budget. One of the core tenets of Medicare is providing people with free public health care at the time of use. Denying universal health care to the most vulnerable people makes zero moral, zero ethical, and zero financial sense. It's widening the cracks for people to fall through. Preventative care keeps people away from landing up in the emergency room. We already know that hospitals are extremely burdened with ER wait times for a bed as high as 21 hours. That's almost a full day. And as my friend MPP Gates here often reminds us, we, the NDP, are the party of Tommy Douglas, the party of Medicare. We've always fought for a healthcare system where no one gets left behind, where everyone is treated with care, with respect, and with dignity. And we're going to keep pushing back against the decisions that hurt people. We're going to work to ensure that each and every single Ontarian gets care when they need it, no questions asked. Now, I'd like to turn this over to Lisa Gillies, who's a community outreach worker here in Niagara Falls at the Community Health Center, right across the street from us here, doing amazing work in ensuring that people are never left without healthcare. And she's going to talk a little bit about why this program is so important. And I just want to say, we've heard the Minister of Health over and over this week in the legislature when we've been asking about this, say, oh, you guys are exaggerating. This is already being covered. Well, it's not. And I want to make sure that the Minister of Health is listening to real people on the front lines, people like Lisa, who are seeing every day why this program mattered. And we're gonna call and continue to call on the government to reverse this terrible decision. So over to Lisa. Thank you.
Thank you. So as mentioned, I work at a community health center. So we offer primary care services. So doctors, nurses, nurse practitioners. We also have an incredible allied health team full of counselors, outreach workers, LGBTQ+ community support workers, dietitian, kinesiologist, and OT. We offer primary care services to folks with or without a health card. So I have been working at the community health center for 10 years. And one of the things that we do as a community outreach worker is support uninsured individuals to navigate the healthcare system. So when this funding came into place in 2020, it was a game changer for uninsured individuals and for the care that our primary care team could provide. Over the past 3 years, there has been countless times when someone who does not have health coverage requires care that is beyond what our primary care team can do, and the CHC funding. This funding has been life-changing. I have been part of multiple conversations with individuals who are required to go to the hospital for further care. The sound of relief when they heard about this funding is not something I can put into words. It has taken away to choose between paying rent or not paying rent, to be able to eat that month or not be able to eat that month, to be able to take care of my healthcare needs or to not get treatment. It has supported individuals through pregnancies, infections, walking around without a broken arm. It has helped folks access further testings like CT scans, MRIs, labs, access to specialists. I have seen this funding help an individual find out that they had lung cancer, access specialists like oncology, get specialized treatment, and receive testing that they required. It provided this individual an opportunity to get the proper healthcare they required for their illness. This funding has saved lives. Without this funding, the outcomes would not be the same. Thank you.
Thank you so much, Lisa. Really appreciate your comments. And I do want to just say, before I wrap up here and turn to questions, again, we've been in the legislature, Wayne and I and our whole team raising this issue every day this week. And in response to us, the Minister of Health is often saying, well, no, they could just go to a community health center. Well, here is somebody working in a community health center saying, no, this program provides a very specific, addresses very specific needs that are not being met otherwise. And so we really appreciate you shedding a little light, and hopefully the Minister of Health is watching and will be listening and will understand why this program needs to continue. And I'd like to now turn it over for questions. Happy to take questions.
I didn't touch on it, Marit. The Minister of Health or the government explain why they did this, why they did this. What's the rationale?
Right. So what they've said to us repeatedly is that this was a temporary measure. And it was, in fact, I think the excuse they give is it was for people who were caught in the country and didn't have health coverage while they were here during the pandemic. But, this is something that's been called for by healthcare professionals, folks on the front line for years and years. It was very important. And I think, and this is what I've said to the Minister of Health is, surely we've learned a few things through this pandemic, right? And one of the things we've learned is that this program saved lives and it was the right and responsible thing to do. And there's no reason to not continue it. As you can tell, it's actually a very small part of the healthcare budget that's impacted, and it has very big impact. So we're really hoping that she'll listen to the frontline healthcare providers out there, the community outreach workers and others who are saying, we really need this program to continue.
Are you hearing as well, voicing their concerns, how others come forward?
Absolutely. Yeah, we've heard from doctors, we've heard from nurses, we've heard from folks in community organizations. Heard from folks working in emergency rooms and in community health centers and in doctors' offices. No, I think actually that's been quite an uproar. There's a lot of unhappiness among folks who actually treat uninsured individuals because there are people who are absolutely going to fall through the cracks. Yeah.
Welcome to our journalists online. Remember to use the raise hand function, and just a reminder, it's one question, one follow-up. I'm seeing no questions.
All right. Well, thank you very much, everybody, for coming out today. Thank you, MPP Wayne Gates. Thank you, Lisa Gillies, for joining us today. I know we're going to continue to raise these issues until the government changes this terrible decision. Thank you.